Harry Martin, and I'm pleased to be your host. The William F. Ryan Community Health Network is taking aim at diabetes. Diabetes is preventable and may even be delayed. The important thing to remember is that you can be in control. So join me in learning about the disease and how you and the Ryan Network staff can hit the bullseye in the fight against diabetes. What is diabetes? Diabetes is a disease where the body cannot produce or cannot properly use the insulin that it makes. Insulin is a hormone that is made in the pancreas, and it helps to regulate the amount of sugar in the bloodstream. Diabetes essentially means too much uncontrolled glucose or sugar in the blood. Diabetes can strike people of all ages in different ways. There are several types of diabetes. We're going to focus on type 2 diabetes, which is the most common form of the disease. The body still makes some, but not enough insulin, or the cells ignore the insulin altogether. Before people develop type 2 diabetes, they almost always have pre-diabetes. There may be no signs or symptoms, but blood glucose levels are higher than normal. Type 2 is more common in people 40 years and older. However, with obesity becoming more and more common, the occurrence of diabetes among younger people is reaching epidemic proportions.
Hello. I'm Dr. Jessica Sessions, Associate Medical Director and Director of Pediatrics at the William F. Ryan Center. Gestational diabetes may occur during pregnancy, even if the woman has never had diabetes in the past. Not all symptoms of diabetes are apparent in patients. However, if you have some or all of the following symptoms, you must tell your healthcare practitioner immediately.
You may experience fatigue, weight loss for no apparent reason, frequent urination, recurrent infections, blurred vision, slow healing of your skin and gums, genital itching, and numbness or burning in your hands or feet. The risk factors you should be aware of include family history of diabetes, obesity, especially around your midsection, high cholesterol, and smoking. You can reduce your risk when you eat a healthy diet and stop smoking. Talk to your healthcare practitioner about getting a simple blood test for your fasting blood sugar. What complications can occur due to uncontrolled diabetes? Diabetes has been classified as a risk factor for cardiac disease, which is the most common cause of death in the United States. Diabetes is also the #1 cause of kidney disease. The kidneys are vital organs which remove waste from your body. If your kidney function is significantly reduced, the situation may become life-threatening. Annual testing of protein in your urine can save kidney function, and when treated properly, this condition may be reversed.
Hello, I'm Dr. Roxana Cruz, the Medical Director at Ryanina Community Health Center. Diabetes can also damage the nerve endings and decrease circulation in your feet. You're feeling that? Mm-hmm. Feeling that? Mm-hmm. Good. Ulcers of the feet can develop from several causes, including wearing tight shoes, constant or moderate pressure on your feet, and fungal infections between the toes. Ultimately, if you don't control your diabetes, it can lead to potential loss of limb.
For my diabetic neuropathy, I have been given medication, and I also see regularly a podiatrist right here at the Ryan Center who keeps track of my feet and the condition of my feet, considering diabetics are prone to ulcers and other diabetic foot conditions.
Many of these problems can be avoided if you just wear comfortable shoes with proper support. Remember to change your shoes regularly. Never walk barefoot. Inspect your feet daily. And do not use a heating pad on your feet.
Hello, I'm Dr. Andrew Gotlin, Medical Director of the Ryan Chelsea Clinton Community Health Center. The eyes are the second major organ system to be affected by diabetes.
Look right here.
The following problems may occur. Glaucoma, which is an increase in pressure within the eye, leading to damage to the optic nerve, cataracts, which is a clouding of the lens, and diabetic retinopathy, which refers to changes within the retina. If left untreated, these may lead to blindness.
Where's better one or?
At the very beginning, I developed cataracts in both of my eyes very quickly. The Ryan Center fortunately has its own eye clinic, and from here they referred me to St. Luke's Hospital, where I had both of the lenses in my eyes replaced, and now for the rest of my life I'll have 20/20 vision.
So far, we have told you what diabetes is, who gets it, and the complications from the disease. Now, we're going to take aim at the disease itself and teach you through self-management how to control diabetes instead of letting diabetes control you. Most importantly, you must always monitor and control your diabetes with a healthcare practitioner. This means keeping all of your medical appointments. The practitioner will evaluate your blood glucose level and obtain something called a hemoglobin A1C every 3 to 4 months. Check for kidney damage once a year. Help you schedule an eye exam once a year. And examine your bare feet each time you visit. Taking your proper medication, staying on a healthy diet, and exercising are a must for controlling your diabetes.
Hello, I'm Dr. Robert Murayama, the Medical Director for the William F. Ryan Community Health Center. The major benefit of exercising is to prevent a heart attack, stroke, and decreased blood flow to the legs. Exercise can also help lowering bad cholesterol and fat and raising good cholesterol. Exercising also lowers blood pressure and may reduce the need for insulin or other medications. It may also help to reduce your stress.
Try to become more active every day. Just 30 minutes a day of activity can help lower your blood sugar and improve your body's response to insulin. Walk more. Take the stairs instead of the elevator. Get off the bus a stop earlier, and do some house cleaning every day. Self-management of diabetes includes checking blood sugar at different times, such as before and after you exercise. Several types of medications control blood sugar. Most type 2 diabetics take a combination of medicines to lower the blood sugar in different ways. Insulin may also be prescribed to achieve optimum control.
Okay, now one of the things I want to mention to you in the beginning of all of the things that you have to do annually as a diabetic. And the first one, and we like to start from the top down, is your eyes. You know that as a diabetic, you need to have your eyes taken care of.
Hello, I'm Gladys Ramos, registered nurse and Quality Improvement Manager for the William F. Ryan Community Health Center. I also teach classes on diabetes self-management. One of the conditions you might experience is hypoglycemia, which is too little sugar in your bloodstream. Hypoglycemia can be caused by eating too little when taking pills or insulin, or over-exercising without monitoring your blood sugar levels. Symptoms of hypoglycemia are sweating, headache, rapid heartbeat, or a sensation of hunger. You can avoid hypoglycemia by measuring your blood sugar as your practitioner ordered. Most cases are mild and can be treated with glucose tablets or foods such as half a glass of orange juice or 2 to 4 pieces of hard candy.
Hi, my name is Ada Colon and I work at the Ryan Center. I am a nurse and a diabetic educator. I am also a diabetic type 2. Come to the Ryan Center and we can take care of you like they've taken care of me.
To anyone who's waiting in the waiting room or sitting at home, I would say come into the Ryan Center because this is the place you're going to begin to learn how to control your diabetes. That's the most important thing. You'll find that you don't have to be afraid. They have a lot of different options, a lot of different ideas. The staff here is very well trained, and they know and have a lot of resources they can use to make your diabetes livable.
Managing and controlling diabetes is a balancing act. You have to stay on a healthy diet. You have to exercise on a daily basis. You have to take your medications at the right time. Keep your medical appointments and get tested regularly. Talk to your healthcare practitioner or nutritionist at Ryan. Screening is important. Treat diabetes, prevent it, and control it. Take control through self-management. Millions of people are living with diabetes, and you can too.